Can I go to Lebanon now? Fadi, can I bring you in at this point, please?
Morning, good afternoon, honorable speakers and Mr. Moderator. I'm probably going to have a question that's a bit more focused on the resilience of the healthcare system, since I've heard from the opening statements that the concern would be giving priority to the healthcare system. So at least we'll have people healthy enough to be able to carry on their duties and build their economies. Lebanon has a very specific, unique case. We're almost in a failed state, unfortunately. Lebanon started negotiations with the IMF due to so many governance issues in the country. And then the recent port explosion, Beirut port explosion, added more burden to the problems that the government of Lebanon is trying to deal with. And right now we have escalating numbers of COVID-19. We have a serious issue with the public healthcare system not being able to get the support and the external financing that's being needed. And the same applies to the private sector that happens to be providing 80% of the healthcare services in the country. Personally, with the Lebanese Parliament and the Healthcare Committee, we tried to talk to the World Bank and we had some virtual meetings also with the financial arm, the IFC, looking into ways to at least be able to bring some funds to the private sector. And this way we can at least take care of the escalation of the COVID-19. And then we ended up with really going nowhere because the IFC required that we have certain guarantees by the government, and the government has failed and defaulted on paying its obligations to the external world and the financial community. So I'm very much keen to say that I would really hope sincerely that the World Bank and the IMF would focus on that specific aspect. But at the same time, we have a healthcare system that's almost collapsing, and we need the support and need the help. Thank you.
Lebanon, I mean, it breaks my heart. I have said that before. A country of entrepreneurial, smart people, dynamic country, and also one that is kind to others in trouble. You have been so generous to find itself in that precarious situation, deteriorating and then hit by the tragedy in Beirut port. We know what needs to be done. We just need to have a partner with whom we can do it. And unfortunately, at least for the IMF, we cannot do anything in the absence of that partner. We are just hoping that there would be an anchor in Lebanon, a government that we can work with. Because what otherwise we face is that the only resource that the country can rely on is the humanitarian support, which, by the way, has been provided in this very difficult time to Lebanon. And I hope that we would be able to treat the malaise by having a good program to revitalize the Lebanese economy. And as for what we do to make sure that money is spent for the right purpose, in the first round of emergency finance, we concentrated only on two things: to have a financial lifeline to pay doctors and nurses and maintain health services, and to protect the most vulnerable people, the most vulnerable parts of the economy. So that was one thing we asked for. And then we asked for accountability. Show us the receipts. Was the money used for this purpose? In other words, are investments done in the right way? Invest in people, education, health, social protection. Invest in digital infrastructure. Invest in the ability to lift up productivity of people, and do so again with as much transparency and good governance as possible.